I'm Dr. Dave Karsten, and again, we're talking about survival during the pandemic time, SARS-CoV-2, and this is an electron micrograph of the virus. So community testing started this week, and so we're seeing jumps in the numbers. They leap from day to day as it ramps up. It's starting to reveal the transmission activity of 3 to 4 weeks ago. Transmission activity would be going to church, sporting events, restaurants, schools, any kind of other public contact, or even people going to see their relatives or friends. Prevention is always going to seem extreme, and that's what people were saying a month ago. Wow, this seems like really going too far, and obviously it's not too far. So if you go back a few days, you can see there were 558,000 cases in the world, and then that jumped to 621,000, and this morning it was 684,000. The US is now the leader in the numbers. We have over 124,000 cases recorded in the US via testing, and we're going to see that number get much bigger because we are doing community testing now. Dr. Fauci this morning announced that we could expect hundreds of thousands of deaths and millions of cases. But he also said, don't hold me to that. If anything, I think he's stating the best possible outcome. My low estimate, also in agreement with many of my MD colleagues, is about 2 million. And that would be based on no vaccine, some continued community transmission, and not overwhelming our hospital capacity. So that would lead to a death rate of less than 1%. If we quickly overwhelm the hospital capacity, however, and that continues, we could be facing 5 or even 7% death rate. So Dr. Fauci is a superb scientist that has held this position ever since 1984. I'm glad we're listening to him. He's providing some guidance based on science, and he is a true hero. Right now, we're faced with a dilemma. Do we favor the economy or people's lives? And I think we're trying to sort our way out how we can have the best of both. We'll see how that works out. So what kind of solutions? Somebody sent me a video of someone blowing hot air up their nose with a hairdryer. That's not going to work. And in fact, if you burn your nose, you'll probably be more susceptible to the virus. There have been talk of using the drug chloroquine or hydroxychloroquine. Those are anti-malaria drugs. There was a report where somebody had used chloroquine that was used as a fish tank cleaner, and the husband and wife split a bottle and took it. The husband died. Well, it was 10 times a dose, and certainly that's not a pharmaceutical grade of chloroquine. There's still continued discussion of vaccine. And realize that vaccines generally take about 5 to 7 years for something new, and this is definitely novel. It's new. If we can come up with some radically different method of developing a vaccine, I'm all for it, but I would not expect one in the near future. Social distancing by order of the governor to slow transmission is a good idea. That way it stops transmission, or at least slows it down a lot. Hand washing is critical. If you touch things, you're going to have to wash. You're likely to get some virus on you, and you've got to wash your hands. Masks, because we're so short of masks in the US, the authorities are discouraging mask use in public. The only way they would really work in a public situation is if everybody wore them. I went over to Fred Meyer to pick up a few things yesterday, and I was very frustrated to see that a lot of people had masks, even the N95 mask, and were wearing them improperly. I wanted to tell them, why are you wasting that? Gloves are important. Fortunately, gloves are in plentiful supply. That can help you not transmit, because you can touch things that are perhaps contaminated, and then you can peel the glove off. Be careful that you don't touch your face. I'm hoping that the gloves will remind you not to touch your face. Be very mindful of whatever objects you touch, and realize that doorknobs and door handles are likely sources of transmission, because a lot of people don't even know they have this virus. It becomes more and more evident that many people don't show very many symptoms, maybe a runny nose or maybe nothing. Antiviral drugs, that's experimental at this point. We don't know of what might be effective or what might not. There are a few that are promising, but we just don't know yet. Quinine, well, that's why chloroquine and hydroxychloroquine were created, is they're artificial versions of quinine. What quinine does, and chloroquine and hydroxychloroquine, is they help get more zinc into the cell. And so I know some people are starting to take more zinc. It certainly has proven effective on coronaviruses that cause colds, making the cold maybe last not quite as long or be not quite as bad. So not a bad idea. I would be careful with zinc though. One of the problems with zinc is that it can damage your olfactory nerve. That helps you smell. It can damage it permanently. Same way with quinine, chloroquine, and hydroxychloroquine, is they can be a problem for people that have heart arrhythmias. So if you have anything like that, you probably should check with your doctor before you start taking anything like that. So going along with the idea of getting more zinc into a cell, quercetin and curcumin can do some of those same things. Curcumin, of course, is in turmeric, which is in yellow curry. Maybe eating yellow curry a few more times a week makes some good sense. But really, one of the biggest things you can do for yourself is have healthy habits. Eat your veggies, get enough sleep, don't eat a lot of junk food, don't drink too much, don't smoke. Be healthier. So unfortunately, with poor compliance, if we don't do what it takes, and with no magic bullet, no miracle, more than half the population could catch COVID-19. And up to 25 million people could die from that if we go with the worst possible outcome. I would say even with a better outcome, PTSD is going to be really common. And so we need to have special concern for people that are caregivers, healthcare providers that are going to be dealing with this in the hospitals, and people like Woody and our deacons. They're going to be dealing with people that are sick and distressed. So they need some consideration as well. Healthcare delivery is going to change in the future. Even after we come out of this, things are going to be different. People are going to behave differently. Everyday behavior is going to be different. Even going to the dentist is likely to be quite different than it used to be. So there are possibilities. What I'm already seeing is great teamwork happening. Just look at our parish team and what they've managed to do in a short period of time. I can look at the team that I work with at OHSU and the protocols we put together to try to help take care of our community for emergency care. Collaboration. We've been put into a situation where we've got to collaborate with all kinds of people, and we've got to do it quickly. And in fact, I see people enjoying that collaboration. And part of this enjoyment is the opportunity to be creative, to use what resources we have in good or best ways so that we cannot waste them and we can be more effective to help our community. This also gives us opportunities for leadership. It's the kind of thing where it's really a carpe diem, seize the day. If you see an opportunity to make a difference, make it. It's also an opportunity for spiritual renewal, and I think a lot of that comes from helping other people. So I'm reminded from Hitchhiker's Guide to the Galaxy, know where your towel is, especially after you've washed your hands with soap and water. You should dry them thoroughly, because otherwise you're going to have your hands get really irritated. And don't panic. Stay in your home as best you can. Contact other people, especially remember the parishioners who are older and are going to be necessarily isolated. Give them a call. Don't forget about our parish team, because they're working awfully hard for you. See you again sometime.